Hi guys, I hope you're doing good. I wanted to talk about plasmapheresis today in this particular video. Now, I don't know if you have heard this name, plasma exchange, which is also known as plasmapheresis, right? Now, when is this used and what is the significance of it? Let's discuss that in this quick video. So I welcome you again to my channel, Exploring MS. If you haven't subscribed, at the beginning of the video I'm requesting you to please do kindly go ahead and subscribe to the channel. Thank you very much in advance. So I was asked to go through plasmapheresis in 2017, and that was when I had lost my eyesight. Now, I got this optic neuritis, right? So the first thing that the doctor asked me to do was obviously hospitalized, and I went through those solumedrol, which is mainly the steroid. Okay, so 3 bottles of steroid, usually it used to work for me. Okay, but this time, even after taking those 3 bottles of steroid, I did not regain my eyesight. So with my right eyes I was not able to see totally. And then doctors asked me that, okay, since I could not see with the initial 3 bottles, I should take another 3 bottles of the steroid, and I did that, right? I took another 3 bottles of steroid. Even after that, I was like completely blind with my right eye. I was not able to see. So that was pretty scary. And then is when my neurologist suggested that the only option that I had left was to go through plasmapheresis. So even I went ahead and I did some kind of research, and I did not understand anything as such, right? So then I went ahead and I tried to understand the process, and all of this was happening in Fortis. Okay, so in Fortis, the doctor who was supposed to do this plasmapheresis process, he explained to me that my blood will be taken from from my body, and then it will be filtered and cleaned, and then the same blood will be put inside again in my body. So it's like maybe they'll put a tube in my right arm, and then it will be attached to a machine. The entire blood will be purified, or whatever they have to do, they'll do that, and then put it back from the left arm, or from the thighs, wherever the doctor feels better. That's what the process was. Now, even after listening to this, then came how much is the cost. So I was checking all of this in Fortis. I'm talking about Fortis Gurgaon. So it was very expensive, like the entire process was coming up to be maybe 5-6 lakh or even more. So that was quite a lot of money, right? So that is when I thought, let me go ahead and check in AIIMS. So I went and I visited Dr. Bhatia in AIIMS, and I spoke to him that this is what has happened. I can't see with my right eye, and then he said that if you have already taken steroid, 6 bottles, we can't give you anything, any more of it. So the only option, if you don't get your eyesight back, is going through plasmapheresis. And comparatively in in AIIMS, it was just costing me about 10,000, I guess. Yeah, so it was very cheap compared to Fortis, of course. And that is when Dr. Bhatia said, there's someone taking plasmapheresis in the ward. You can go ahead and see the process and come back and tell me if you want to go through it. So I went there, I saw this guy who was taking it. I was very scared to go through that. What I could see, I don't know, I mean, like I saw this guy. There was a huge tube which was which went inside his mouth also, and from one of his arms there was a tube which was which was extracting his blood, and then there was a huge machine in between, and then from the other side, maybe through his thighs, the blood was again getting inside his body. So I was not comfortable doing this, so I went ahead and I told Dr. Bhatia I can't do it. Then that was when he told me that okay, you take steroid, as in like the oral steroid, so I took that for almost more than 1-2 months maybe, and then after like 3 months I regained my eyesight. So that was a slow process, but I opted for it, right? But had that not worked, I should have been going through plasmapheresis myself. So anyone who needs to go through plasmapheresis, it might be a little scary in the beginning. Even now, if you ask me, I don't think I have that much of strength to go ahead and get myself admitted and get that plasmapheresis done, because I saw how it was happening. So that was a little scary, but I'm just trying to explain you the entire process, right? So for patients with multiple sclerosis, sometimes when you get those kind of flare-ups, mainly for RRMS, right, when you get those attacks and when you get those flare-ups, and if you're it's not working, if like even after taking steroids, if it's not working, then might be that the only option left, maybe, I mean, I'm not a doctor, but maybe could have been this, right? So at least in my case, when I was going through this optic neuritis and I was not able to see, that was one thing that was prescribed to me. But thankfully, with God's grace, I didn't have to go through it. I undertook, obviously, I took this oral steroid for a couple of months, and eventually after maybe end of third month, I gained my eyesight back. So anyone who has to go through plasmapheresis, you can think about it. If there's no option and that's the only thing that you have to do, then you have to do what you have to do, right? I mean, we don't have much of a choice there. I think this helps you in understanding what plasmapheresis is, and helps you in making the right decision too. And I'm hoping this video helps. Thank you for watching. Take care. Bye bye.